Hi everybody, my name's Paul Turner. I'm an osteopath healer, and what I wanted to talk to you about today is I'm going to talk about finding the primary problem pattern. Okay, the reason this is really important is because in modern day education and research, a lot of practitioners focus a lot on the symptoms and tissues causing symptoms, but I want to show you theoretically and practically how vitally important it is to look at the primary problems behind the scenes that are setting up those tissues causing symptoms. So I'm going to talk about this diagram and all the little parts and pieces, and then I'm going to give you a few practical exercises to prove to you how it works, so that gives you evidence that this works. And I'll get you to do that on yourself so you can test it in your own lounge rooms or wherever you're watching from. So the first thing we want to talk about is we're talking about finding the primary problems, A.R.T. So I'll get to what A.R.T. mean in a minute, but we'll look at this one first. So I've talked about this in other videos before, so I'm going to just be very brief here. But if you look at what's healthy in the body, healthy areas will show ease, function and balance. And when you look at the relationships between any two parts of the whole person, those relationships will be balanced. They'll be functioning, they'll be healthy, they'll be easy. And that leads to a healthy quality of relationship between people, and that's basically a unifying state. So that's why I've represented health by a circle. Now, when I talk about health and healthy relationships, I'm not just talking about physical relationships between musculoskeletal tissues and organs. I'm talking about mental, emotional, energetic, physical, spiritual, the whole works. Okay, so this holds true on any level. But if you go down here now to dis-ease, if you look very carefully at the terminology here, so what I've done here is I've drawn a picture of a circle and I've coloured a little bit in to represent there's a part of the whole system that's out of synchronicity with the whole person. So there's now a part that's in conflict. If you look at the language, you have now dis-ease instead of ease, you have dysfunction instead of function, imbalance instead of balance. And if you look at any of the relationships now between the problem area and the surrounding health, it's always good in assessment to look at the healthy areas. And then you'll notice the parts that are out of synchronicity. If you just look for problems, you won't notice that background health. In this case, it's a simple problem because most of the person is healthy and there's a little part that's in trouble. But if someone had a chronic health issue, this would be the other way around. And I have other videos going into this a little bit more detail. But if you look at relationships, there's now an unequal relationship. In other words, there's a difference between this area, which is now not functioning correctly, and it's not easy and not relaxed, and the rest of the tissues. So there's conflict. Conflict creates imbalance, imbalance dysfunction, dysfunction leads eventually to disease. And how you recognize these areas of dysfunction in the body, these areas of relationship imbalance, is you look for what's called A.R.T. Now A.R.T. is a concept, principle, which is usually found in a lot of the old osteopathic textbooks. In modern years it's become T.A.R.T, but T, the first T is tenderness. That's really what the patient feels, not what the practitioner feels. So it's been added in because of the overemphasis on tissues causing symptoms. So I'm taking that back out because I'm focusing on what us as practitioners or healers or anyone trying to look at our own in a system can actually find to give us clues to actually areas that really need treatment and which areas don't need treatment. And this is what I'm going to do examples on. So A represents asymmetry, range / quality of motion abnormality. Now the reason I've got quality emphasized there, and I have talked about this before as well, is because in the original books it said range of motion abnormality, but people focus on range, and range doesn't mean anything. It just tells you something's limited, not why. It's the actual quality of movement that tells you how it's functioning, because remember this definition of health? The relationships have a healthy quality. Whether it's limited or not doesn't matter. So for example, if I had you standing here and I pushed you down towards the ground, your range of movement would be limited because I'm stopping you. So, but within that range of movement, you can actually move okay. This completely healthy function. It's just that you're hitting a wall, which is me. So in that case, I would be the problem and you're feeling the effect into that limited range. So range doesn't tell you what's really in trouble. The quality imbalance would be when you hit my resistance. Now we have a quality imbalance that stops you from moving effectively in that full range, for example. So that's just one example. So that's, and then tissue texture change is what you feel in the tissues. Your tissues will tell you, they'll give you feelings, you know, about the texture, the even if you're talking about the mind or the emotions, they'll still have a feel to them that you can pick up on, tune into. So let's go to this part of the diagram next. So we'll come back to that. This primary problem, regional problem, this is sort of comes from any therapy which has got a holistic philosophy behind it, of which osteopathy is one. But also I went and did some research on this because I felt that the primary problem, the primary relationship issues in the whole person weren't being addressed. Okay, because in modern day focus, we're focusing more likely on symptoms and effects. So when we talk about primary problems or causes, this is investigated in assessment with there's a holistic emphasis, and it looks at the relationship imbalances in the whole mechanism or the whole person, the whole being, that set the stage for the tissues causing symptoms or slow recovery. And what I mean by slowing recovery is that that interferes in the body's natural healing mechanisms and therefore slows nature in doing its work. It's got nothing to do with symptoms other than it's putting pressure on other areas which then can become symptomatic and overloaded over time. But these are the things which actually prevent people from healing, especially in chronic health issues, because in a chronic health case, there may be multiple relationship imbalances, not just physically, but between a person's mental state, their emotional state, their physical state, their organ systems, and so on and so forth, that collectively contribute to loading up the system to a point where it can't cope anymore, and then you'll get symptoms in the area that's not coping. And that brings us on to this regional symptomatic approach, which looks at the tissues or conditions causing symptoms. But you have to remember that that's looking only at one relationship, the relationship between the tissue or the condition that a person has and the symptoms that they express. So it may be a person has asthma causing breathing problems, or it might be that a person has a joint issue causing back pain. So it's only looking at that issue. And this is the primary emphasis in the modern education and research, I find. It's more of a biomedical emphasis. That's not to say that the biomedical approach is not holistic. There will be practitioners in medicine that do take a holistic view, but the education and training leans primarily, as far as my experience is shown, on the emphasis on the regional or the symptomatic. So that's the idea. So I've got a little question mark over here that if you look at the education and research that's out there, of which we're supposed to rely on, most of it you'll find will be on this and not very much on this. When I did my research, I couldn't find any holistic research exploring this primary problem relationship. Now, sure, there are some there, but philosophically and in terms of research on that, I didn't find any when I did my research. So I'll come back to that as well. So that gets us on to this problem here. So if we look at what you might call primary problems and secondary problems. So primary problems relate to the part of the whole person that's most interfering with health, okay? So I'm going to relate all these diagrams. So we're not looking at symptoms here, we're looking at what's going on in the whole person that's the worst area, you could say, that's affecting the whole person's health the most, okay? That'll have a sequence of cause and effect relationships, which eventually load up the body and cause symptoms somewhere, okay? Which means this is tackling then this aspect of the diagram, okay? So when you look at primary problems, what I'm going to talk about now is the practical clues that you can observe and feel when you're feeling the body, you're observing the body, and you're checking the quality of movement. There's the three tools we have to investigate and find these. And these are the clues in the body that tell us something needs treatment or whether something doesn't need treatment, whether it's causative or effects. So, for example, and I'll demonstrate this in a moment, a primary problem will have all three of A.R.T. It has to have all three of A.R.T. in terms of altered symmetry, range / quality of movement and texture change. It's consistent in all postures, which means that if you assess me standing, sitting, lying, that problem will still be there, but it might be aggravated in a certain posture, which is why when we take a history, a person might say, oh, I'm worse standing. So what that means is when a person stands up, the body can't adapt. It's in a position where it can't adapt very well, can't compensate, so the pain becomes more obvious. When they sit down, it might relax the secondary areas, but the primary problem will still be there slightly masked, which is why a person might say, I feel a bit better sitting, for example. That's just one example. But if you actually have a pay attention, to what you're feeling and seeing and moving, you're going to find that the problem will still be there, whether it's slightly masked or more exaggerated. Okay, and that's a clue that it's an area that's treatable. And the other clue is let's say you find 2 or 3 areas in the body that are in trouble. Let's say the pelvis, the middle back, and the neck. When you take pressure off a primary problem that's affecting the person the most, it's going to relax those secondary areas. So if you have someone with neck pain and you've got a little bit of imbalance in the neck, and you take pressure off the pelvis and low back, and that's primary to the neck, when you take pressure off it, the neck will relax. That tells you, before you even start treatment, how much change you can get in the neck with a successful treatment, assuming you treat well. In a chronic case, because some of those secondary problems become more set in, they might become primary in their own right, they might start to become dysfunctional. So you get this concept of which is the worst of the worst, and if you treat one area, it'll have more effect on all the other areas. And as you treat the right spots in the body, it'll show you where to treat at any point. In other words, it shows you whatever a person's ready to heal, it'll bring up what I call a primary problem. So if you deal with that primary problem, and then you go and have a look back at the whole body will look and system will feel better and look better and move better. But then it might change and reveal another area that now needs to be addressed. So the system actually shows us, if we pay attention, what to treat and when to treat. And you have to relate that with the health, because if you look at health, health shows you what's healthy, the problem shows you what's in trouble. And what we're trying to really do in treatment is not to alleviate symptoms straight away, but we're trying to restore healthy relationships between the healthy areas and the problem areas, so the whole system's more balanced, which will take pressure off the tissues causing symptoms, which will then relieve the symptoms. And probably 70 to 90% of the time, you don't have to treat symptoms. And I'm going to try and prove this to you with a little exercise. Now, if you go to secondary problems here, secondary or adaptive issues, they'll have 1 or 2 of ART, but not all 3. And they may actually also be tender, which makes sense because they're under stress. They're either compressed or stretched, therefore causing tenderness, for example. I'm talking more on a musculoskeletal level, but it can happen on any level. If you change the posture, so when you assess a person, let's say you assess me, and you notice that standing my shoulders are really unlevel and I've got a shoulder problem, and then I sit down and my shoulders are doing the opposite, they're going the other way, and then I lie down and they're doing something different, that's a changeable finding. That means that finding is adapting to something somewhere else. Otherwise it wouldn't change, it would be the same. That's a clue that the area with the symptoms could be an effect. Now there will be tissues in trouble there, but they're the effect of something else, and this is how the body tells us. So I'm really talking about how to listen to the primary evidence in the tissues of the body that tells us what to assess and treat. So it changes in different postures, so therefore it's good to assess standing, sitting and lying, and in lots of different ways to see what's changing and see what's not changing, because that's very informative. And also when you take pressure off the secondary problem, so in that case with the neck pain causing from the low back, if I take pressure off the neck and then feel the tension, the changes in the tissues in the low back that I've already acknowledged, it won't make a difference. In other words, take pressure off a symptomatic tissue and it doesn't have any effect on a cause. But if you take pressure off causes, it will have an effect on effects. That's the idea. So these are the clues. If you really pay attention to what you do in assessment and treatment, you will find this for yourself. This is absolute truth. It works. And the reason I'm emphasising is because even though this is in our philosophy, I don't know a lot of people who actually pay full attention to this consciously. It's more unconsciously, not consciously. So we're trying to make it conscious so we can get back to our holistic origins and philosophy. We use all the best that science offers us because that'll help us explain the effects, but to explain the relationships between the primary problems and the secondary, that comes from a good holistic assessment. So if you come over here, you'll find that in assessment, because when we're talking about assessment, the primary thing with assessment is we're looking for the areas of primary relationship imbalance. We're not looking for symptoms straight away. That comes when we get to our regional and symptomatic assessment. By the time we even get to that, we will have an understanding of all these relationship issues in the body that are setting the stage for that tissue that's in trouble or that condition. That gives us context. And if we understand how those tissues are loaded, how they're getting affected by our past traumas and other things going on in the body, that's going to enhance our ability to treat, because we can take out some of those predisposing problems to take the pressure off and the stress off the symptoms, therefore helping that symptoms to heal, the person to heal. And nature does the healing then. We don't have to do the symptoms. When we treat symptoms, usually we're just doing first aid treatment anyway. So really, the body will heal itself if everything is balanced in relationship. If it's not balanced, then it's like mowing the lawn without pulling the weeds out. It all looks good for a little while, but it tends to come back. The weeds tend to grow back. So if you treat the primary problems and you observe the effect on the whole person, it tends to have a more long-term effect on the whole person. It's longer lasting, and you'll feel it change a lot of other things in the body. Because when you treat an area that's maybe secondary or adaptive or an effect, it's very local effects only, so it's more temporary. And it also, it won't last, it'll tend to come back. Now that's not to say that symptomatic areas don't sometimes have primary problems in them. Sometimes they do. Sometimes the area where the pain is also where the primary problem is, in which case you will find all three of A.R.T. Now I'm going to do some practical examples here. So one is just a reasoning thing. If you imagine I have a restriction in my sacroiliac joint, all right? So the tailbone and the pelvis. If there has to be asymmetry present if there's a problem, because the joint is either squashed together, compressing it, or it's stretched. In other words, there has to be asymmetry because the normal space is either shorter or longer. Because there's ligaments crossing the joint, if you compress the joint, it's going to be more compressed and jammed up. If you stretch it, the ligaments are going to be taut, so there must be, logically, tension, texture change. But is it functioning okay? Okay, and if it's under too much stress or too much compression, that would logically cause tenderness, inflammation and pain. But is it actually functioning? That's the important question. If you then check the quality of movement of that joint and you find that it's actually moving, then it's actually an adaptation, it's not the primary problem. It's just the part that's loaded. Okay, so that's why I'm saying a secondary problem may have one or two of A.R.T. It may be tender, asymmetrical or altered texture, but it technically functions. But we as practitioners, and I've done this myself, and I've seen so many people do this, if someone comes in with neck pain, they ignore all the findings and just treat the neck because the neck is painful. But if you actually check the neck, it might be hypermobile. So if you treat a neck that's hypermobile by manipulating it, it's actually negligent and contraindicated because there's too much mobility already. So you can't treat based on purely on symptoms, and nor can you treat purely on the fact that there's pain in an area, so you have to treat it. You have to understand why that area is in trouble. And 90% of the time, neck pain or headaches, for example, might get relieved without even touching the head and neck by treating the primary problems lower down most often, for example. But that, I could spend days going through cases and explaining all these relationships, but the concept is really important. I'll give you another example. So if that SI joint did have a dysfunction, then it means you can treat it because there is a problem there that needs addressing to get it back to function. And if we go back to our definition of health, it means the relationships are functioning in harmony. So, you know, I can stress a ligament and over time that ligament become worn and it can wear down and tear, but that technically has become symptomatic, but it's actually functioning as well as it can under the circumstances. So example 2, if I have two men in a boat, okay, and a sailboat, and one bloke is leaning over the edge obliviously looking at the fish under the water, and the boat starts to capsize. The other person, if they're aware of the whole boat capsizing, has to lean to the other direction to maintain the balance and keep the whole system healthy. So here you have a system that's technically functioning, but it's not symmetrical, and that person who's leaning over is going to be tense. And the longer they're there, the more tense they're going to get. So the person that's doing all the work will get stressed and symptomatic. The person leaning over the side is probably not going to feel any pain or dysfunction, but they're oblivious that they're causing problem. So the solution here, the treatment here, is not to treat the person who's asymmetrical and tense because he's functioning. If he wasn't functioning, he'd fall out of the boat, right? So he must be functioning. So that's a secondary problem. In order to correct the situation, you have to get the person to realise he's obliviously looking over the edge, get back in the boat so that the stressed person can come back in the boat and everything's balanced as a whole. So that's one example. Second example, if you push me over, I normally do this with a person, but let's say you are standing next to me and you push me over to the side, to the left, right? So I'm leaning like the Leaning Tower of Pisa. So am I symmetrical? No, I'm asymmetrical. What are the muscles going to do to help support my posture? Okay, the muscles are going to get tense, especially the muscles that are working harder. So I've got muscle tension. Am I functioning? This is the question I usually ask groups. So, do you think I'm functioning? Well, yes, I am functioning, because if I weren't functioning, I'd fall over. I wouldn't be able to stabilise myself. Now, if I stay there for a whole day, what am I going to feel like by the end of the day? I'm going to get fatigued. These muscles are going to break down. I'll get to the point where eventually I can't function anymore, so I'll have to collapse. Now I have A.R.T. So if I go to see the local masseur or the local therapist and get a treatment, they're going to, now those tissues need attention, and I've got them back to coping again. But if you're still pushing me over, you're just going to need another treatment next week, and another treatment the week after, and the week after, because the original cause is still there behind the scenes. So the relationship in balance is not between the tissues and the symptoms, which are doing their job. If you actually try and relax them to maintain balance, you're doing the wrong thing. You have to get this relationship between you and I balanced. Then I'll stand up straight, and all of a sudden my muscles, joints, tissues are more stress-free, and the symptoms will let go. That's the second example. So I'm trying to illustrate how sometimes when we're learning massage or we're learning assessment, we get so caught on the tense muscles that we have to treat them, and then we wonder why they're not responding when we're treating them. They're not responding because the body's saying, I need to be tight to support my posture, thank you very much. Don't focus on me, get the other guy back in the boat, for example. So you have to look at the whole picture and notice which parts of the whole system are causing the most distress to everybody else. I remember reading a book somewhere that said, something like 73% of the world's problems are caused by 1 or 2% of the world population. Well, it's the same in the human body. It's usually the primary problems that cause everyone else hassles, and we all focus on all the distractions and forget the primary problems. So now we come to the final bit I want to talk to you about now. I want you to do this on yourself at home, and then I'll talk about it. So I want you to imagine that we're creating a problem. So we're going to create a problem in the thoracolumbar area. We're going to imagine there's an issue there, and we're arching the back and side bending and rotating. So there's a definite asymmetry. We're going to imagine that that's dysfunctional. It's not moving anymore. It's not functioning. And it's locked there. It can't move. So if you look at my posture, I'm already adapting. My shoulders are uneven. My weight bearing is not correct. I can steady my head to make sure that I'm level. Now, I'm already asymmetrical. I'm already in trouble, but I'm not getting any pain yet. I'm still pain-free and not symptomatic. But if I walk around like this, and you do this yourself, create the problem and walk around like that on the spot, or walk around your living room, and ask yourself, how would you start to feel after a few hours of doing this, walking in this crooked posture? Now, even before you do that, ask yourself this question: where do you feel stress in your body? Is it when you think about your whole body, we're adapting to this problem to maintain overall balance? Where do you feel stress? So I'm feeling a bit of stress in the neck, a little bit into the right knee. So are you feeling pressure in your head and neck? Are you feeling it in the opposite side of the back? Are you feeling tension in your pelvis or knees or ankles? And ask yourself, are you feeling any pain or discomfort where we've created the problem? And sometimes it'll be no. Some of you it'll be yes, but a lot of people it's no. Now I did this, you can relax for a bit, but I did this with a group of 100 people once at a talk, and I got everybody to do this exercise. And once everyone would walk around like that for a while, I said to them, how many of you feel symptoms, head and neck, shoulder, opposite side, back? How many of you feel pain where we've created the problem? And out of the 100 people, there was probably 5 or less, which is like, it's only what, 5% out of 100 of people have pain where the problems are. And everyone had symptoms elsewhere in the body. So then I asked them, why are you all feeling problems in different parts of the body? So have a think about that. Why would some people feel it in the neck, some people in the opposite side of the back, in the stretch side, not the compressed side, some in the legs? And the answer to that is that you all will accommodate differently to the same stress. That's one answer. In other words, you all might adapt differently to the same problem. The same problem will be there, and if you were to assess me, you would find that in different postures. But you adapt differently to the same stress. And the other reason is you've all had different past histories. So you've all gone through life where you've had other knocks and falls that collectively load up your body. So let's say you had an old injury to the shoulder, and you start to adapt and go, well, the old injury is playing up, so I can't go that way, so I have to go this way. So how you're feeling today, right now, is a combination of all your past, all the traumas and stresses in your past loading your system, plus the current stress, which is overloading the system. And the areas that are under strain, the neck, the shoulder, the back, the knees, will be the areas that are symptomatic. So when you assess, sure, you assess those areas, but you need to stand back, look at the whole, and you'll notice this problem. And you'll notice it's not moving very well, it's altered texture. It might be hiding behind all the, obviously the further away from that pivotal point you go, the more asymmetrical it gets. So you might get a lot of asymmetry in texture here, but we're not looking at symptoms, we're looking at where's the part of the body that's not functioning the most. And that might be hiding, masked. That's one example. I'll give you another example. We went on a bike ride once, and there must have been at least 30 people that came in into the massage rooms. We had a whole team of different practitioners treating, and we had about 30 people with knee pain. 3 of them had both-sided knee pain. Most of them had one-sided knee pain, and out of the 30 cases, only 3 of them had any history of trauma to the knee. The rest had just started for no particular reason. Now when you get that, it's a classic sign that something else somewhere else is loading up that knee. So when we assessed these people, we found that probably 80% of them had issues from the pelvis through to the middle back that were loading up the body, and with the imbalances in the posture together with gravity and the riding and all that was loading up one knee and causing symptoms at the knee. When we assessed the knee locally, using this principle, we found that the findings at the knee didn't really find very much off weight bearing. On weight bearing, you'd feel the knee and you'd notice it was all under pressure, and when they came off weight bearing and gravity is now acting through rather than down, suddenly they're changing, findings are changing. There's no solid findings at the knee other than a little bit of tension and asymmetry. And there can even be damaged ligaments and meniscus and whatnot, but that's the long-term effects of long-term stress. Most of the primary problems, however, were in the trunk. And when we treated all these primary problems and then looked at the posture again, the pressure was off the knee was feeling better, all of them walked out with no pain, every single one. The only 3 we needed to treat locally were the ones that had a history of trauma, because there was something going on locally that had a dysfunction. And the 3 people with knee pain on both sides, they all had troubles in the upper body, which was altering their posture. Now to demonstrate that, rather than just think about it and think, oh, I don't know how that works, if you imagine that I've got chronically shortened suboccipital muscles, because I've been riding a bike for a long time and I'm used to that posture. Let's say they get so short and stuck that even when I stand up, I can't loosen that area. So imagine you've got a problem here, that's the problem, make it short and stuck so it can't move, and then adjust your posture so you feel you're as balanced as you can be, and then walk around like that. Now when I walk around like that, my knees are flexed, everything's crooked, I'm now feeling pressure in both knees. And the same sort of thing, where do you feel pressure? Is it upper body, lower body, left side, right side? And so when we treated the right primary problem, the person stood up straight and all of them walked out with no knee trouble. So literally 100% of cases, 95 to 100% of cases, all got improvement by treating the primary problem areas and relating it all the way back to the symptomatic area. And sometimes when you go back to the symptomatic area after a treatment and you recheck all the findings that you felt before, a lot of them are gone. And sometimes you still have to do something locally, but you don't have to do as much. It might be like there's 10% to go. So that's the idea. So the body will again show you the order of treatment. And it doesn't mean ignore this. And some people will have the problem at the knee you have to address, but a lot of people, especially with no particular cause, it'll be other things. So that gets us on to the final thing I want to talk about. So there's some practical examples, and you can test that with yourself and with other people and see for yourself. But this is the question. If we're supposed to be basing our practice on evidence-based medicine, and we're looking at the science that's been done by scientists, if they have no idea of how this works, they're going to be doing research on the tissues causing symptoms, and that'll be accurate only when the problem falls inside, the real problem falls inside that symptomatic area. So for example, I did some research for a talk once on headaches, and a lot of the research on manual therapies was investigating techniques for treating the neck for headaches. Now the theory was about how effective is treatment techniques on the neck to relieve headaches. Now the results were only about 5% of people. This is just a summary, you'd have to look it up for yourself, but the results were basically saying that only a few people got significant relief. In other words, which comes back to that example I was talking about. If the neck itself is an adaptation to problems lower down, and you're treating an effect, that's not going to have long-term effects. And that's exactly what a lot of people do. They treat the neck for head pain, but the problem could be in the rest of the body. I've seen heaps of people with headaches, and probably 70 to 90% of them get relief that's lasting fairly quickly, simply because you're treating the person with the problem, not the part with the symptom. So the question is, we're supposed to rely on external evidence-based medicine to help guide our assessment and treatment. But I'm saying to you that that's secondary to the primary evidence in the body. The body will tell you what you actually need to do. The research that you look at in science is just telling you what the collective population of practitioners are doing and how far they've come in understanding this whole person. So you need to have practitioners to do research on this. So for example, you could have, you could get 100 people with knee problems, and you could get half of the group treating their primary problems in the body, and the other half just treating symptoms, and compare the relationship. That would be an interesting study. But the problem is, and this is the problem, because when it comes down to education and research, in order to understand this, you've got to teach this first. So if people aren't getting taught that, and they're getting focused on that, they're not going to go and do the research on it because they don't actually understand it. So your first step is to understand how to assess holistically the principles behind it, why it works and how it works. The next step is to try it and practice it enough so you can reliably get evidence from it. And I can tell you from my experience, this is 100% reliable if you learn to listen to the body. And it always leads you to the right spots to work if you look at relationship between health and disease. So the tissues will tell us. So this is primary tissues. And then when you look at the research, you can see if the research is just expressing these relationships or whether it's just looking at a part of it. Because if we start to rely on evidence, what other people tell us to do, we will treat a person based on what the latest research tells us. And what does it do to us? We forget to actually double check it's actually working. So how do we know the research is accurate? Well, when we do our assessment on the patient, we're going to find the same things that the research is telling us. So the research is meant to share this knowledge with the world, not to limit us to a particular viewpoint. Okay? It's not meant to convert us into doing what other people tell us. It's meant to support this holistic assessment process. And if we look at that, it'll support the treatments and the techniques that work in harmony with this. But most research is looking at techniques, most research is looking at symptoms. So they'll say, I'm going to try and do manipulation on the low back to help back problems. I'm going to do massage to the low back to treat the back. And it will have some effect, but it's all working on the tissues causing symptoms and not on this relationship. So this is a big question mark. I think in any field, practitioners who are, and there is some research out there on the effects of holistic treatment and how that helps people when it's appropriate, but there's not a lot on what actually, how you actually tell what to treat, and this is what I did my research on. Now, to finish with, so I want to leave you with that question mark. We need to make sure that, yes, look at what the evidence says, and there's a lot of very good work that's been done, but is there enough is there research being done on this whole problem? And I suggest this is the primary emphasis we need to take to help with chronic health issues, because I don't find chronic health issues that hard to treat because of this process. And practitioners that understand this process will usually get better results with people with chronic health issues. And I've created a whole course on how to do this that reinforces what you're learning at college and slots in the general assessment, and it slots in all these principles and how to actually feel and recognise what the body's telling us. I've got this whole course there waiting to be used, but everyone's so focused on this they don't even realise it's missing. So I'm just going to finish with that. I hope that that talk has given you plenty to think about. I've done plenty of work to explore this in teaching, even in research, and in my little courses. There's plenty of information there, it just needs people to look at it and to try it and test it. And I know from my teaching and those that have watched it and done the work, as they start to understand this, treatment gets easier, people get healthier and more lasting effects. So thank you for that.